The Salling story is one that's familiar to a growing number of San Diegans coping with family members who have Alzheimer's and other age-related conditions. Joining me with more on the situation here and where to get help are my guest, gerontology specialist and professor at SDSU School of Social Work, Mario Garret, and Mary Ball, CEO of the Alzheimer's Association of San Diego and Imperial Counties. Thank you both for being here.
Pleasure.
Thank you. Mario, paint us a picture of the aging population here in San Diego.
Well, everyone knows about the baby boomers. What people do not know, though, that we have about 500,000 older adults right now in San Diego, but that will quadruple, multiply 4 by 2030. So we'll have about 2 million 60 and over population. But what is unique about San Diego is we have different cities with different patterns of aging. So, for example, you go to La Jolla, Del Mar, Coronado, where we get more than a third of the population are older adults. So we get patches in San Diego of aging. But also what is unique in San Diego is the Latino population. 37% are Latino.
Let's come back to that because I want to talk specifically about those neighborhoods and those groups. But Mary, I did want to talk to you about this growing population here. I know research says that there's about 5 million Americans that have Alzheimer's, and that it's the 6th leading cause of death here in the country and the 3rd leading cause of death, you said, here in San Diego. What services specific to Alzheimer's is available here in town?
Well, the Alzheimer's Association here is to support families and the person with Alzheimer's disease right when they get diagnosed. So one of the first things we do is we offer a helpline. It's 1-800-272-3900. People can call it 24 hours a day, 7 days a week, and talk to trained clinicians in Alzheimer's disease and get answers to any of their questions.
So would these people be able to help them find services? Let's say they didn't have Medicare, or let's say they didn't really have Alzheimer's, they had some other sort of dementia?
Absolutely. And then we have staff that will follow up with people through their journey and ask them, what are the services that they need? How are things going? How can we help you? So the association is here to help them through what is most likely a 10-year journey with Alzheimer's disease.
And Mario, talking about this long-term journey, let's go back to these patches and these groups you were talking, especially among, not geographically, but among ethnic groups. Your studies have found that the Latinos are at risk of really growing.
Incredible, and not just the Latinos. We specifically looked at Latinos because they're such a large minority in San Diego County and Imperial County, but also Asians are in the mix here. With Professor Ray Valle, just published a paper today, The Population of Aging, and what we found.
Well, go ahead.
What we found is that even though the Latino population will increase 6 times by 2050, the Alzheimer's rate will go 11 times higher.
So 6 times in population growth, but 11 times, so disproportionately.
And that is because there's some preconditions that Latinos suffer more than the other populations: diabetes, high blood pressure, cardiovascular disease. And what we need to do is, what we're talking about is, by 2050, 95,000 caregivers being impacted. 95,000, that's just in San Diego County. So we need to be a little bit more proactive, which we are not very good at, even though in San Diego we have a lot of very good services. You know?
And let's talk about that. Mary, how are you preparing here as far as when I'm specifically thinking about, there's a lot of people that are in the, like the story we saw in this sort of gap area, right? That maybe their insurance doesn't cover it, maybe they're not ready for a hospice, maybe they have Alzheimer's. How is your organization and others like you preparing for this change?
Well, we're always trying to build additional capacity because, as Mario said, the numbers are skyrocketing. There's 60,000 people today in San Diego County living with Alzheimer's disease. Estimates are in the next 15 years, that number's going to double. So you're talking 15 years from now, over 100,000 people living with this disease. So we are trying to build more resources. To our helpline, we're getting over 500 calls a month. Our calls to our helpline are up 68%.
Wow.
Over last year.
So it's definitely going.
It's a quiet epidemic out there in San Diego and across the nation that as a community we've really got to put resources in and put more programs in place to help people.
And the problem with older adults is it's not just Alzheimer's, it's other
Right.
issues.
All sorts of health issues
Health
that they
issues
can't
and
get.
medical issues, transportation issues, income issues, so housing issues.
Right,
So
right.
they're all combined. This is, and what we are doing is we are addressing them purely as a single
Instead of
problem,
together.
rather than as a transformational issue.
Unfortunately, we are out of time, so I want to send people to our website, kpbs.org. There are links for these services. They can find out more about your research, so that's kpbs.org. Thank you both for joining us.
Thank you.
Thank you.